All right, welcome everyone. So this is virtual town hall number 5. And today we have a special guest, a member of CIH, Kari Willford, will be doing some myofascial release with us later and leading that virtually here. So thank you so much, Kari, for coming on, and she'll be with us in a few minutes. And I hope everyone's enjoying the weather outside or have gotten outside a little bit today. It seems like a pretty nice day. We'll talk today first about some updates on COVID and CIH, and then we'll go into myofascial release for most of today's session. So the first thing is that it seems like social distancing is working. The Maryland coronavirus site here, coronavirus.maryland.gov, has demonstrated that although the curves haven't totally decreased yet, they have flattened over the last week. So the number of ICU beds, acute hospital beds, and death curves have actually flattened. So we just continue to do that. Social distancing and rapid detection of coronavirus and quarantine are all important. But it's also important to keep moving our bodies, keep connecting to people as we can. Through Zoom like this and through other media to keep ourselves physically distant maybe, but not necessarily socially distant. The virus is mutating about half the rate as which influenza mutates every year. So that is happening. People are studying that. And then also, I think generally speaking, we want to try to, in COVID-19, increase interferon levels to reduce viral replication and also to decrease IL-6 or other inflammatory cytokines that would otherwise promote inflammation. So there's a course I'll be talking about that we're going to be preparing for in the next couple of weeks that I'll talk about in just a couple minutes. And then this is a nice article that Laura found, or Ivy Nurse found this week, on open access article on nutrients for a healthy immune system. And these are relatively conservative recommendations for immune system health. We'll be talking in a group course about our recommendations more and about the physiology behind that and details behind that. Because inflammation is actually driving severe responses to COVID-19. So even if someone gets COVID, it's really the inflammation that's killing people. And so we know that the roles of blood sugar regulation and vitamin D status have shown to be very strong predictors of whether or not someone gets hospitalized or dies from COVID. So controlling the inflammation is really key there. And then otherwise, there's some new drugs that are being developed in process by Dr. Liu at Texas A&M, as well as some vaccines being developed. So there's a lot of things that are happening right now in terms of research. There's also Mount Sinai that's doing research on how blood thinners are actually helping, because the role of inflammation in COVID-19 is that one of the things that happens is the iron ion called ferrous iron ion gets oxidized to ferric ion, and then that causes more inflammation, vascular blood clots, which then leads to vascular inflammation in the lungs, which can cause problems with breathing. So a lot of people are now recommending blood thinners as one of the protocols there. And we can talk about how we can also do that naturally. So I think about recommendations just really quickly about, labs to consider. So we would consider checking some of these vitamins here, and you can see these on the screen here. Vitamin D, zinc, and protein levels are very important. That's why I bolded those. And there's some other markers that we'll also go over in our group class more. And then there's some lab antibody testing that's available at CIH. We would have UC Paula, our physician assistant, that is doing those kind of acute visits on telehealth, and then you can come in here and Murtasha can draw you with a LabCorp draw. And those results are in 2 to 3 days. They're billed to insurance. We also have a Ray Biotech point of care test, which is a 10-minute test. Some people are doing that today, actually. So literally you can know your results if you have that antibody or not in 10 minutes. That's pretty nice. That's also built to insurance. And then a DSL stool test is also available too. So I just wanted to say thank you to all the nurses out there. If you know of a nurse, please thank them today. Get them flowers. Nurses are the backbone of the medical system and of the healthcare system, especially right now. This is so important. So just want to thank Laura and Marna here, part of CIH. Laura's our head of the IV nutritional therapy program, and a lot of you know Laura if you've done IVs, so thank you, Laura. And thank you to Marna as well. Marna is our nurse practitioner, and she is expert in integrative functional medicine, so thank you, Marna, as well. So happy National Nurses Week, everyone. We also want to welcome another nurse, a happy Nurses Week to Meg as well. Meg is our second IV therapy nurse. She's starting the week of June 1st. She'll be training a couple weeks before that with Laura to complement Laura, and she's joining CAH, so we're super excited for Meg to be here, so welcome, Meg, also. So by June or so, by early June, we'll have IV nutrition therapy available 5 days a week for you so that you'll have more access to nutrition, to IV nutrition. And we're also adding, starting today, IV zinc to the immunoboost because zinc has been shown to inhibit viral replication, and it's really good for the immune system overall. It also decreases blood sugar, and it helps with the function of the white blood cells. So a lot of reasons to add zinc to the immunoboost. So we're adding that to the glutathione, vitamin C, B vitamins, and magnesium. We also want to welcome EJ. EJ is our physician assistant that's been training with me in integrative primary care and functional medicine for several months now, and she was a student before that and training with me as well. So EJ's been really great with her patients, and she's going to be starting to see patients here on her own on Monday, June 1st. So please book an appointment with EJ. And if you know people that need more holistic care, then have them come see EJ as well. And she's going to be doing integrative primary care, like annual physicals and well woman exams, care for 18 and up, acute care visits, health optimization, and then support for conditions that are integrative and functional based here. That's where that shines a lot. So hypertension, cholesterol, diabetes, as well as thyroid, other hormone issues, gut issues, working with our nutrition team, and brain health, chronic infections, and like EBV and things like that. So we're really excited to have EJ on, so welcome EJ as well. So we're welcoming a lot of people today. And then Dr. Hiza is a friend of mine, and he's partnering with us. He's a great physical therapist, doctor of physical therapy. He is owner of Kimbia Physio, and he's partnering with us to treat our patients here at CAH. It's part of our team here now with regards to acute and chronic pain conditions, optimizing functional movement patterns, and also reversing osteoporosis or osteopenia. So had a lot of great success with patients with him, and that's starting. Telehealth physical therapy with Dr. Hiza is starting next Monday. So if you're interested in this, and I think a bunch of people are already on our list to be contacted, you will contact Gina Washington. Gina Washington is our new patient coordinator, and she can book you in for appointment with Dr. Hiza, so that should be great. So welcome Hiza. And just to kind of go through really quickly, I have a couple more minutes here, an overview of the visits as they currently stand, and we're kind of always monitoring this to figure out when we should bring, reintroduce more of our services as, hopefully the curve starts to go down a little bit. So we are doing lab draws, we're doing IV nutrition visits right now, and then we're also doing medicine nutrition visits that are on telehealth for the most part. I am seeing people in person if needed at this point. For physical exams, we're slating for June for there, but we're gonna keep looking at the public health trends there to reopen that. For acupuncture, Liz is seeing patients and seems to be enjoying that, so that's great. And then all others are on telehealth right now or haven't started back their practice yet, so we'll keep everyone updated on that. And then we're also, another exciting announcement is we're having health coaching that's coming pretty soon, so we'll probably have more of an announcement of that next week. And then let me see, yeah. So group class, so we're gonna have a group class. There are gonna be 2 sessions available. It's gonna be available to CIH patients, and it's gonna be billed to insurance. You have to be a patient here. And there's 2 sessions available. One is Tuesday, May 26th from 12 to 1:30. The other is from Tuesday, June 2nd from 4 to 5:30 p.m. So please message Gina Washington and Charm to register. That's gonna be a great class focusing on how to be the CEO of your own health, of your own immune health, so that you can really fight off and be strong, for anything that might come your way, as opposed to waiting for something to happen. This is about taking charge of your own health. We're gonna have a lot of details, a lot of protocols in there, a lot of practical tips for how to strengthen your immune system and how to balance your immune system. So I really look forward to doing that class with you all. And some fun pictures. So this was a couple days ago. You see Martasha here drawing some labs. Michelle's at the front desk, smiling face there. Christine is here, she's our practice administrator. I'm here with my full PPE on, which I have somewhere around here, but I'm in my own room right now. And then Laura's here treating a patient with IV vitamins. So we want to ask about this. So this is a poll question. I think Jen has that. So what topics are you interested in for future town halls? I'd love to see, we had some preliminary votes, so just wanted to see herbs for immune health, group meditation, or other. Please tell us in the chat and I can try to announce that here, what people are kind of interested in. Let's see. Chat, okay. Yeah, Betsy did the test yesterday. It was easy, great. Thanks for the feedback, Betsy. Stress reduction, Irene says stress reduction. Yes, I agree. That's probably top of mind right now for everyone. And hopefully the Myofascial today will also result in stress reduction. Thank you for attending today. I know this is a valuable time for your lunch hour and really glad that you're here. So welcome everyone. Didn't say that yet. So definitely people are interested in both herbs for immune health and group meditation. Really appreciate that. We'll definitely be offering these too for sure over the next couple of weeks. Immune boosting. So Babby, we're going to have a class on immune boosting, and it's in the talk today. It's there's going to be 2 sessions, group immune class. So I'll have an hour and a half with me there on both of those days. Joanne, thank you. Yes, only a single choice answer there. So yeah, we're going to have both. We're going to have both, I think, for sure, just by the amount of interest in this. Thank you. And then we have a Facebook group, private group that you're all welcome to join, called the CAH Tribe. And it's a place for you to connect to your CAH community, to get access to additional content, to share health tips, and to meet like-minded, health-oriented individuals, because health doesn't happen in a vacuum. Health happens in a community, and we've been very thankful so far that we've been only we've had only about 7 days of the tribe so far, and we already have 200 members. So we're very excited about this, and there's a lot of great interaction going on, sharing of recipes, sharing of you know, tips on how to improve health. And so this is a great resource for you. So please join that, and we'll welcome you there. Thank you. The myofascial release, Kari Willford is a very experienced expert myofascial release therapist, and she'll tell you more about what fascia is and what myofascial release is. So the rest of the session will be with Kari, and I'll be enjoying that with everyone here. So thank you so much, Kari, for coming on and for doing this with everyone.
And Dr. Wang, you'll want to stop sharing your screen so Kari can come up.
Got it.
Hi, everyone. Thank you for having me. I'm Kari Willford. I'm a myofascial release therapist here. I wanted to help you with some self-care techniques so we can increase awareness in our body and relieve stress. So first of all, what is fascia? Fascia is a 3-dimensional connective tissue that is from the top of our head to the bottom of our feet. It's in between each cell, and it's our support, structure, shock absorber, and flexibility in our body. So when we're under stress, if we have any type of trauma, physical or emotional, which would be stress as well, injury, surgery, chronic bad posture, like being on a computer for long periods of time, or repetitive movement, our fascia can be thickened and become dehydrated. So these stretches are key in maintaining our wellness and health. Myofascial release was developed by John Barnes. He's a physical therapist in the Pennsylvania area. He has 2 treatment centers, one in Sedona, Arizona, and one in Melbourne, Pennsylvania. He developed this technique through his own self-healing, and he's been teaching for over 40 years. So he's quite a master. This technique is characterized by long sustained holds or stretching. So when I coach you through these stretches, we're going to hold them for a period of 2 to 3 minutes, and I encourage you in your daily practice to use them from 3 to 5 minutes or even longer. After 90 seconds or 2 minutes, the body starts to produce an anti-inflammatory protein called interleukin 8, and the body also starts to reorganize. So we're allowing the tissue to soften and reorganize rather than forcing the system. So that's very key to this method and to the success in opening the tissue. Sorry. Yes, while we're in the stretches, we never want to force the body to release, so we won't go into end range. I'll coach you into finding the barrier into the tissue, the body's endpoint, and then we'll hold there. And then as the body softens and reorganizes, then you can go deeper into the stretch. So I have this elastic band. So if this was your normal range of tissue with your posture, we just want to hold it taut to engage. How's that? We don't want to go into a deeper stretch. Think of all the nerves and blood flow in that area. So we don't want to stretch beyond comfort. We want to listen to the body. This is a great practice to improve that. A release can feel like taffy pulling or butter melting. It can feel like you just have more space in that area. Sometimes it comes up with a pulsing or tingling or a change in temperature, often heat, but it could be coolness. Images could come up, old memories. If we hold it for a long period of time, we can have emotions come up. And it's important just to be a witness to these pictures or feelings, and just know that it's coming up and out, and we don't have to address it in that moment. Just stay with it and feel it, and your body knows what to do. Nothing will come up that you're not ready to deal with, so don't be afraid of that. And you're probably already aware of those emotions on some level, and when they do come up, it will give you great relief, either physical or emotional, or create more mental space for you. Contraindications. So we don't want to do this over any healing fractures or dislocations. We don't want to do this around any open wounds, of course, or any hypermobile joints. We want to be very careful in areas of arthritis. It's very important not to overdo any stretches. So again, strengthening that listening and body awareness within yourself. If the stretch feels like too much, it is. Just please back off, soften the joint, deepen your breath, and come back. Okay, let's talk about softening a little bit. Let's go into an exercise for a moment. Let's see, I have a question. Okay, let's do a softening exercise. Let's take a few minutes and ground. You can close your eyes. Take some deep breaths in and out. And just find your natural flow. And on the next inhale, hold for 4 seconds. And then let go. And let's do it again. And let go. And as you hold, notice that pressure building up in your chest and rib cage. The more air you take in, or the longer you hold. As you pause and exhale slowly, notice how the tension eases naturally without any effort on your part. That's what softening feels like. And when we hold these stretches for a long period of time, that's what we want to feel, that gently letting go, either on a physical realm, gently letting go of the stress and the tension in the tissue, or those repeating thoughts in our mind, the repetitive mental stress or emotional. Okay, so using that softening exercise, we're going to begin with a neck stretch. So either side, let's just begin by elongating through the spine and allow one ear to tip towards your shoulder until a stretch is felt. So right in here, either side. You can use one hand to press the shoulder down if you want an additional stretch. You can hold on with this hand, the shoulder that you're depressing. You can hold on to your chair for a deeper stretch. This is only deeper if you don't feel a stretch and just turning your head. This is fine. And just tilting your head. But remember, you're holding these for 2 to 3 minutes. So you can tip your nose down towards the ground to find a place. You can experiment with the angle of your head. You can tip your nose towards the opposite shoulder if you feel more stretch in that area. Go back to your breathing and remember to check in with your breath. You may feel other parts of your body speaking up. It's possible to feel the stretch in your shoulder, jaw, or face. As the area softens and lets go. After you do not feel tug or stretch anymore, you can change the angle of your head. Experiment with where the tightness is in your body. And keep holding and breathing. You can also tip your head up to the ceiling. Excuse me, your nose. Rotate your head up to the ceiling. And that will get a different angle of your shoulder. If you find your body wants to move or shift around, please allow it to do so. Give yourself permission. Take the brakes off while you're in these stretches. Give yourself permission to go deeper, move around, or find ease. And slowly coming back to that with your head coming back to neutral. We're going to do the other side. So elongate your spine. and tip toward your other shoulder. And again, you can depress the shoulder down with your opposite hand, or you can reach the hand down towards the floor or hold on to the chair and tilt away from this area that you're stretching. If you're not finding a stretch along here, you can tilt your nose towards the opposite shoulder, opposite of what you're stretching. You might find differences from one side to another. You might find some similarities, or you might feel it in other areas of your body. A pull or a tug, that's that three-dimensional web, that fascia connecting to other parts. Sometimes it feels illogical, but that would be a good indicator to stretch that area next. If you feel maybe a tug in your mid-back or maybe a tug in your hip. And breathe into the tightness. Softening and letting go. These areas around your neck are really important for the circulation to your brain and the oxygen and lymphatic flow. A lot of lymph nodes throughout here. And let's hold here for another couple of breaths. Change the position if you need to. Use this opportunity to soften deeper. And let's come back to center. Is everybody doing okay? Anybody have any questions at all? Is everybody doing okay with the stillness? It's really helpful for our nervous systems to have a chance to, thank you, Dana. It's really wonderful for our nervous systems to be able to have this stillness and gentle pressure, because that's when our body can start to heal. It's not in that flight or fight. It's just being held and calmed. So that's extremely helpful, especially in this time. Most of us had plenty of busyness and stress before this time, but now, you know, this is such an unknown, of course. So it's helpful to just give yourself the feeling of being calm and come back to center. So that's why I feel like these are especially helpful. So now we're going to do the front of the neck. I picked this one especially because anytime we watch the news, or anytime we hear news, or even going out in the public, we want to close down here because we're afraid to breathe. I shouldn't say we are. I am. So we're going to hand over our sternum. That's a long bone here where the collarbones connect. one hand down onto it, and you can put the other hand on top and elongate the spine so you're sitting up tall. So gently press into the chest with your hands and gently pull down, so that idea of the elastics, the elastic straps. We're not pulling too tight. We're just feeling into, oh, I feel a stretch there. And you can maybe even see it. But stretching here and elongating through your spine. You can gently tip your chin up. I also want you to be very careful with your cervical vertebrae. So even if you don't feel it initially, give it some time. Give it a minute or two. Pressing in and down. Gently lift your chin. I'd feel this on one side more than the other. You might feel this into the jaw or TMJ. Very careful with this area. This can be a very vulnerable area. So just be gentle with yourself. What I mean by that gentleness is if any thoughts or feelings come up, just hold them with, hold them like they're fragile, and just be very mindful that you're handling some fragile emotions maybe. Just be very careful with them. Again, readjusting if you need to, lengthening the spine and pulling down in that sternum and creating that stretch through here. If you're feeling it on one side more than the other, eventually you can turn into that side. I'm turning away from my right. Sorry, yes, my right. Again, your body's going to be different from mine, so experiment with the rotation and angle. Keeping your awareness in this area that we're stretching. If it's helpful, remember that softening exercise that we did in the beginning. If any of this feels like too much, back off and take a little bit out of the stretch and start again. Keeping that compression on the sternum and also pulling down towards your feet or the floor. And stay in this for a couple more breaths. Again, the breath is so important. If you feel yourself experiencing the emotions, more intense emotions, or more feelings of tension or restriction, breathe through it. Allow that blood to circulate the oxygen to those tightened areas. The breath is key. And when you're ready, soften the hands on the sternum, come back to center. And let's roll our shoulders up and down, and up and down, and back, like you're rowing a boat, and forward, and rotate the head. One side to the other, and nod. Chin down towards the chest, and gently up, not too far back. Gently down towards the floor, and up. Okay, now let's do some arm and chest elongation. So I'm going to have you reach back behind you. First, we're going to keep the hand neutral, straight. You can experiment with extending the hand or flexing the hand if you don't feel anything with the straight hand. But so many of us are on the computers that this will get really tight. You want to be mindful of opening and also be mindful of the nerves that come through here. This can feel very tight, so let's be very careful when we're doing this. So sitting at the edge of a chair if needed and just reaching back. You can also grab a wall if you have that available, but I find this to be very helpful even when I'm driving in my car. After I'm working and I've used my arms a lot, I tend to just reach back and let everything open up. Gently straightening. If you feel a lot of nerve sensation, just soften the elbow. Still reach back. You can gently turn your head to one side. Also give another component to this lengthening. You may feel this in your neck, your chest, back, shoulder, arm, forearm, or your hand, or any combination of these areas. It all depends on what is tight in your body. Again, you can experiment with the rotation of your neck. Sometimes it takes us a minute or two to feel these stretches, and that's totally normal. It's important just to stay in it and stay with it and stay with the sensation. Allow your body to move in response to the stretch if it feels appropriate. So if your body's kind of asking for some movement, take the brakes off and let your body move into that new space that your body's requesting. These areas in our body do a lot of work for us. So if it feels right, you can even send a little gratitude to this part of our body and to the whole body, really. And again, if there's any discomfort, take some deep breaths into it. See if the breath changes anything. This is helpful to do midday or at the end of the day if you spent a lot of time on your computer. Just getting the body to reset and realign. And let's soften the joints and bring back to center. Roll in front Flex, flex and extend, flex and extend. Big circle the opposite way. And let's do the other side. So we're sitting tall and we're just reaching behind us. Again, start with that neutral wrist, and then you can experiment with the other angles. Reaching behind you. And tilt your head towards the opposite side of the shoulder. Soften your elbow if you feel like the nerves are speaking up and it's uncomfortable. Nerves could feel, if the nerves are feeling too, if the stretch was too much around the nerves, it would feel like electricity or uncomfortable tingling. And as your body opens up and you have more room to stretch, you can experiment with the angle of your wrist or hand or fingers or into the head and neck. And breathe and relax into it. Find the areas that can soften. Continue to hold for a couple more breaths. Listening to your body. Just feeling the stretch, but not pushing past any discomfort. Just creating awareness in your body. Imagine the circulation getting to these areas now of openness and expansion, reduced inflammation, more freedom in the body. Okay, coming back to center. Flex and extend, flex and extend. Rotate up, back. Let's do a big circle. A big circle forward. One more. Okay, for upper back stretch, consider stand. You're going to bring one hand around yourself on the shoulder here, and the other one, same position. You're going to hug yourself and gently open and spread your shoulder blades. So thinking about the shoulder blades coming further apart. And keep your neck soft during this stretch. Take a deep breath here. You can experiment by raising your elbows, or even allow your head to drop forward. So wherever you feel that first little pull, and there might be more than one, there might be several. So experiment with that and stop and stay there. Go back to your breath. And since we can't hug most other people now, enjoy this. Opening into that mid-back. You can maybe even feel yourself being able to breathe a little deeper with your hands. Feel what that feels like. And give yourself permission to move. If your body's requesting some movement to a different area of tightness, allow that to happen. Maybe some twisting. Separating your shoulder blades and lifting up. And since we are compressing the heart space here, let's be very gentle again with any emotions that may come up. Just hold them ever so slightly, just witnessing them. Take a couple more deep breaths. And when you're ready, come back to center. And sitting up in your chair again. Raising your shoulders and depressing them. Opening your chest, reaching behind you. And reach up again. And reach behind you. And up again. It's really important to rehydrate these areas. So make sure you drink a lot of water. Sorry about that. Make sure you drink plenty of water this afternoon and evening. You can message me if you have any questions. You can gently open your eyes, and Dr. Wong, I will give the screen back to you.
Thank you so much, Kari. That was amazing, and hope we can do more of these with you here. It felt great to hug myself and to do all the stretches, and I felt a little blood flow go back up to my brain. I think a little light bulb came on there, so that was great. Thank you so much. I think there's some questions or people raising their hand possibly. Let's see. There's a couple questions for Kari. EJ asked about, should we hold our breath when we're doing the stretch? I think, hold on one second, where's the chat? Yes, and people are saying thank you Liz, thank you Dana, thanks Jen, etc. And then everyone else, thank you so much for staying with us here for this. EJ asked, do we still hold our breath 4 seconds while stretching? If Kari, you could comment on that. And then Christy has a question too.
I think Kari did respond in the chat. She said that
she did. Oh, okay.
Yep, she said no need to hold the breath. That was the softening exercise. Yep.
Okay, so Christy, I think, may have a question.
Yeah, so Christy, you're able to unmute yourself now. And then I think Elizabeth Ashburn had a question about Kari being able to work with in person.
Yeah, Irene and Elizabeth, yes.
So Christy, if you want to unmute yourself, you can. And then I don't know if we want to talk about working with Kari in person and how to do that. Christy has no question.
Okay, she said no question. Okay. Hand, your virtual hand is up, stretching, doing some myofascial. That's one of the things I learned about, which I just wanted to share, and I don't know if this is relevant or not, but hopefully it is that the weight of the head's about 12 or 13 pounds. So literally a 12 or 13 pound bowling ball, sitting on your head. And so the neck is what Kari was teaching me, is the neck is basically the point, at which you're basically connecting this bowling ball of your head to the rest of your body. And so, as Kari was saying, stretching, activating the circulation, the lymph flow, and connecting that bowling ball of your head to the rest of your body really is, I felt a difference there. I don't know if everyone could comment on that. Just, feeling a difference in stretching those areas up there in the upper body and the neck, just more blood flow up there. I just felt my energy was lifted. And I think we're going to discuss more about how to get more of this out to everyone here. It sounds like it's a great response here. So, and yeah, Kari can see some of Jenny's clients whenever she's able to practice again. So we can talk about that. Are there any YouTube or online resources? Definitely more blood flow. Yes. Blood flow is good. Blood flow is good. Thank you, Maria. Good to see you on here too. Yeah, Kari, do you know of any other YouTube or online resources, or we could talk about other ways to provide more time with people? Myofascial stretching, a guide to self-treatment book on Amazon. Okay, that's a good source. How many people felt an emotional release? I felt emotional release too. As I was doing that on my trapezius there. Not only physical release, but emotional release. And Dana was saying that the back stretch helped release the calf muscle. Yeah. Thank you, Dana. So I'll check out that. And the fascia is really, as Kari was saying, it's really this web of interconnected tissue that's wrapping around all of our organs or tissues, connecting them together, literally affecting all of our organs, all of our enzyme production. Every single organ you think of in your body, fascia, which is also another organ that was recently discovered in the last few years as a independent organ, but it literally is interdependent with all the other organs. So everything is kind of playing together like a beautiful musical harmony here, and the fascia is connecting everything. So literally as we're teleworking more, as we're zooming more, on here, as we're kind of sitting more, and you're not moving as much, or not getting outside as much, not moving your body as much. So the fascia gets tight, and so we need to really make sure that we're releasing that on a regular basis, so that our systems can function optimally. Christy did ask a question about, is this similar to Rolfing? What's your take on that, Kari?
Is it okay just to speak? Can you hear me?
Yeah.
Okay, sorry, it's just taking me too long to type. What I'm familiar with in regards to Rolfing is that not forcing the system, not forcing the release. So that time component of the Barnes myofascial release is really what is the big difference in Rolfing versus myofascial, and even other myofascial modalities that are not the Barnes approach. It's just that stop where the body tells you to stop, and that's that gentle place of stretch, and then let that release, and then go deeper as the body reorganizes. Rolfing, I don't believe, has that principle or foundation.
Right. It doesn't. Well, I've had some Rolfing treatment too. It's also very beneficial, but doesn't have that 90-second release, which I think makes a huge difference there for the muscles and the myofascia. Kari, I have a question. So, how did Barnes get to that 90-second or 2-minute? How did he kind of figure that out, that the muscle gets the fascia gets released after 90 seconds?
Well, like most of us people in this industry, through his own injury. So he was in a lot of pain. I think he had a back injury, and he was holding it. I think he was holding a sacrum, if I remember the story correctly. But he was holding it for a long period of time and pressing in. I guess intuitively he knew that that's what his body needed, or that's what he felt like he needed. And after holding it a long period of time, he discovered that his body was changing. Like his body was responding to that pressure and the duration of the pressure.
Mm-hmm.
So through his own healing.
Yeah.
Thank you.
Thank you. Yeah. And there's Carla Stecco, I believe, is a scientist that's delving into the sciencey part of it. Is kind of interested in that. Is in Italy. She's written some, I believe, some books on this, and the fascia, and how, kind of the science behind the fascia, and how it really informs and supports the rest of the body, and how it's really crucial to to the body's health. And I would also think emotional and spiritual health as well, right? Because we know that from a lot of our healers at CIH that the emotional energy also gets stuck in the fascia, and releasing the fascia is a key part of emotional release too. So I also usually encourage people, when they do body work, to also work with either a therapist or a trauma therapist or a counselor, someone that can a trusted friend that can help process those emotions as they get detoxed out of the system. I don't know what your thoughts are on that, Kari, about that.
I think yes, if it's whether it's like a mental pattern or an emotional pattern or a physical restriction, I think that yes, there is evidence of something is being stuck, and we can work at it. If we can work at it through movement or stretching to open up those pathways, and that's what acupuncture does. It's to open up pathways and let that energy flow. So,
Yeah.
And that's why, I was saying there may be emotions coming up, but it may be purely physical, and
Yeah.
or any of it. If it feels stuck, there's something, the energy is not flowing. So.
Yes, I think, thank you, Kari. This has been an amazing session. Thank you so much. I know some of you have to go, it's 1 o'clock now, but Elaine has one question for, I think, all of us. Last week's town hall, I think Liz was on here last week, and I think she mentioned work on the vagus nerve. She's going to be doing next week a guided meditation. So that will be next week, next Thursday, May 14th. Please tell your friends, please tell your family members about that. That's going to be great. I'll be talking a little bit briefly as well about any updates that we have for the clinic and COVID-19 next Thursday, and then we'll launch into the guided meditation with Liz Baer. It's going to be a great session. Really looking forward to that, as well as today's as well. So thank you so much, Kari, and thank you everyone for attending this. The vagus nerve, just to answer that question, by doing breathing, by working on the myofascia, by doing acupuncture, some of these things that we can all do to calm down the nervous system, that's what is stimulating the vagus nerve. So we're going to do a lot more of that next week as well. So really appreciate you all being here, and great to see all of you, and we will see you next week. Thank you so much.